Bonjour. Hi, Dr. Boileau, Tim Sargent, Global News. At the beginning, you were talking about the transmission levels are starting to improve, and there's good indication of that. And you also said the ENESS was saying that hospitalizations should start stabilizing within the next couple of weeks.
Yeah.
So if the indicators are going in the right direction, why are you requiring the mask mandate to be extended until mid-May if the signs are looking promising?
Yeah. It's because those signs are expected. I mean, those numbers are expected. Right now, there are signs that it's moving down as a transmission, but not necessarily on the hospital situation. So we have to be careful with those numbers because we're just coming out from an Easter period of congé and of release, and the data that we're using might be uncertain. So we would prefer to keep the careful looking at the numbers for a few days. We've said that we've recommended it because there is still a real pandemic situation right now in the Quebec. It seems to be not as worse as it was a week ago, but it's still very heavy. So and the data coming from Cyrano is still showing numbers of over 30 to 50,000 persons per day. So it's still really active. We have to be careful with that. And if the numbers are really showing a drop, then we can revise our recommendation to the government concerning the obligation of the mask wearing.
Thank you. Next question, Lauren McCallum, CBC.
Yes, thank you for taking my question. I have a question about the flu. You said that it's on the rise. In English, can you tell us a little bit more about the conflict or the imposition this poses on the hospital system, and what can people do to avoid getting it?
Well, first of all, the flu is still moving up. We have numbers showing that it's in progression. Last week, we estimate that it was a low level of contamination. It's not a moderate one. It would not be a surprise for us that will get intensify over the next few days or weeks. And with that in mind, we wish all the persons to be careful, and especially for the ones that are at risk of developing issues that are not that we would not like them to have, like hospitalization or really bad situation for their influenza diseases. And with that in mind, we certainly agree that the measures are similar from the one to COVID-19. So wearing masks is a good option for that. It should not be mandatory for an influenza situation. It's more related to the COVID situation right now, but they have to be careful. On the side of the hospital, I would like to leave my colleague, Dr. O'Partney, to answer more.
So the other thing we mentioned was that it's the first time since the beginning of the pandemic that we have both COVID as well as influenza really at the same time in people. As Dr. Boileau mentioned, both conditions have very much overlapping symptoms, and both are being seen in the emergency rooms and are causing an additional strain on the emergency rooms. As Dr. Boileau also mentioned, in terms of staying home and not being out and about when one has these symptoms are the same for both conditions. But it is the first time in 2 years that we're seeing both of them active at the same time.
Thank you. Next question, Matt Grillo, CTV.
Yeah, good afternoon. Question for Dr. Boileau. We see the third dose rate, vaccination rate, it's considerably lower than the first two. In some months from now, down the road, do you worry at all that the fourth dose perhaps will be even lower, considerably lower than the third dose?
Well, the first thing is that, yes, for the first two doses, it was clearly an uptake really widespread throughout the population. It was great for that. And most of the people have been well protected against the virus, and especially for Delta situation in the recent month. Having had two doses is still something that is quite good, but not as good as three doses. and we have to follow the science with that and recommend it to be taken. What we observed is also that more than 87% of the population over 60 is well protected with the third dose. So the people that are really at risk right now, they are not the only one, but really at risk for the sad progression of the BA2 are well vaccinated. So are we concerned about the progression of the willingness or the interest of the population over vaccination? Yes, we're always worried about that throughout the world, but in our experience in Quebec, we have one of the best response from the population to take those innovations and benefit from it, which is great. So we expect that there will be a follow-up on this willingness and with good advices, and especially if we're confronted to a new rise eventually of the COVID situation with that variant or other, we are really confident that the people will follow it and will prevent themselves to develop very sad issues with that.
Thank you. Next question, Siddhartha Banerjee, Canadian Press.
Hi, Dr. Boileau. I also, in keeping with the vaccination question, I wondered, do you have any idea how the fourth dose is doing here in Quebec? And also, do you have any data on whether or not the people that were very concerned about using mRNA vaccines, if Novavax has changed anything for us here in the province?
I will answer for the Novavax first. We have some data that a few hundreds of people have already benefited from the Novavax opportunity to be vaccinated, because, as you may know, some of the people were reluctant to use the ARN messager potential of vaccination, which was still very good. So with that new tool of Novavax, we think that we're reaching for other people that were just waiting for it to arrive. So that's great. Concerning the other question related to the fourth doses, it's moving very well. Mr. Paré was with me, who's the Deputy Minister, Associate Deputy Minister in charge of that, was with me earlier today and was confirming that just yesterday we had more than 40,000 people that have received their doses, mostly fourth dose. So should they be in long-term care unit or RPA or citizens that are at home, they are benefiting from it. So we do not have the numbers completed over the four doses, but it's going well.
Thank you. Next question, Caitlin Thomas, Montreal Gazette.
Hi, my question is for Dr. Boileau as well. I'm wondering why you're not bringing back the mask mandate in schools if you're extending it everywhere else until the middle of May.
Yeah, well, it's still mandated in school, but not necessarily when the students and children, in fact, are in the classroom. So it is still mandatory during their walking around and every other places that they're going. We made analysis of the risk and the benefit of wearing masks inside the school, inside the classrooms, and was not seen as relevant enough to introduce it again as mandatory. Was great for the past. I mean, the people that suggested it were working very seriously, but right now with the data that we observe, it's not necessary. And by the way, the situation in most of the schools of Quebec is globally moving down. So it's the numbers of cases have not reached the one that we had in January for the students, and it's still, I mean, for the data of last week compared to the week before and those of this week, it's moving down, which is great for the students.
Merci. C'est la fin des questions en anglais. Est-ce qu'il y a d'autres questions dans la salle? Il nous reste quelques minutes. Oui, Madame Dubé.
Concernant davantage les enfants, étant donné qu'il y a beaucoup d'éclosions dans les écoles, est-ce que vous maintenez le fait qu'on ne rende pas obligatoire le port du masque en classe? Et pourquoi?
Oui, en fait, le port du masque, il est maintenu obligatoire dans les écoles, mais pas dans la classe. Donc, on a bien étudié cette question. Elle est pertinente. mais nous ne jugeons pas qu'il s'agirait d'une mesure qui éviterait ou qui réduirait substantiellement les risques de contagion. Les enfants sont assis dans la classe et il n'y a pas ce niveau de risque comparativement lorsqu'ils sont ensemble dans les corridors ou qu'ils jasent dans le gymnase ou autre. Là, il y a vraiment une différence importante de ce côté-là. Maintenant, il y a des cas, mais ils ne se multiplient pas. Les éclosions sont bien contrôlées. Ce n'est pas tant des éclosions que des enfants qui présentent des symptômes. La plupart d'entre eux, on estime qu'ils sont pris dans la communauté, avec leurs amis, en dehors de la classe, dans leur famille et autres, quand ils jouent dehors ou ils font d'autres choses, plutôt jouant dedans. Alors, donc, nous, on juge toujours qu'il y a plus de bénéfices que de risques de maintenir, de ne pas forcer les enfants à avoir le port du masque en classe. Je vous rappellerai aussi qu'il y en a un bon nombre qui continuent à le porter. Alors, ce sont des choix de la part des enfants pour toutes sortes de raisons. J'imagine qu'il y a aussi des raisons pour la COVID, mais chose certaine, c'est qu'il y en a plusieurs qui continuent à le porter.
Alors, j'ai du temps pour 2 prochaines questions, une en français, une en anglais. Marie-Ève Cousineau, Le Devoir. Madame Cousineau, Le Devoir.
Oui, désolé du délai. Madame O'Patterney, vous nous dites que justement, on est capable de gérer la situation actuelle avec le nombre d'hospitalisations, tout ça, mais qu'est-ce que vous dites aux soignants à qui on parle chaque jour sur le terrain, qui se disent malgré tout épuisés, qui maintenant même craignent de ne pas avoir leurs vacances d'été? Qu'est-ce que vous leur dites? Parce que c'est eux finalement qui subissent la pression sur le terrain.
J'aimerais quand même dire que c'est pas comme si, c'est quand même une situation qui est difficile. On a quand même plus que 2000 hospitalisations avec le COVID. Et effectivement, les soignants sont fatigués. On a quand même réussi à donner des congés pour la semaine de relâche. Il y en a qui ont eu ça pour la longue fin de semaine qui vient de passer. Alors, le plan puis la vision, c'est vraiment de continuer à prendre ça en considération et de voir comment donner des congés au courant de cet été. Parce parce que effectivement, comme vous dites, il faut quand même, ça fait 2 ans qu'ils travaillent dans ces contextes plus difficiles, très difficiles. Et le contrepartie, c'est que maintenant qu'on peut, puis on pense que, mais là, comme on a dit, les chiffres vont aller en diminution, que d'habitude en été, c'est une période tranquille pour les virus. Et nous, on pense que les vacances sont importantes et on va être en mesure de les donner. Évidemment, il faut contrebalancer ça avec la volonté qu'on a de rehausser les activités pour faire le rattrapage dans tous les différents secteurs où il y a du rattrapage à faire.
Next question, Lauren McCallum, CBC.
Thank you. Just Dr. Boileau, if you can tell us in English, we're looking at the INES figures, the projections from today. It would appear that there is going to be a dip. In other words, looks like we've hit the peak of the 6th wave, but Easter hasn't been factored in yet. Can you tell us, have we hit the 6th wave, the peak of the 6th wave, and what impact will Easter have?
Well, I know the methodology of INES quite well. I was the CEO and president of this organization until recently, 3 months ago. And we had this discussion with the CEO of INES this morning and the expert, Dr. Mike Benigeri. And as you may have heard before, INES those projections are mathematical ones and made very carefully with a lot of methodology that will figure if it continues that way, then it will be that in 2 weeks. But continues that way, it's still something that we're not sure about because we only have 2 data from this week. During the weekends, it was very low, and it should not be a bias or confusion measures that will figure that this lowering will still be there. So with few more days, we'll be more confident on that. But there is a strong hope that we'll get there. And normally Ines is not missing the call, and which is fortunate is that, as Dr. Opatarni said, there is about 2,400, maybe we'll reach 2,005 in a few days, but it should not get really more than that. And on the intensive care unit, it's still around or less than 100 beds, which is great right now. And Dr. Patani said earlier that only 5% of the cases are moving to the intensive care unit, which is really different from the other waves, and which is great for the health system because it's really challenging everywhere in the hospital, but especially in the intensive care unit.
Thank you. Next and very last question, please.
Yeah. Hi, Tim Sargent again, Dr. Boileau. Just to follow up on what my colleague was asking earlier about the vaccination rates, especially for the third dose. When you look at the numbers of the young adults, 18 to 39-year-olds, the percentage is still very low. It's around 38%. Yeah. It's been like that for quite some time. Why do you think it is so low for that young adults to get that third dose, and what needs to be done about it?
Well, it's most probably related to the fact that they are not very afraid from this BA2 situation, and a lot of them feels, in fact, that they are sufficiently immune to get through an infection of COVID. The other thing is that there's a lot of them that's been infected with COVID, and namely Omicron, and now with BA2. So with that, and especially with the situation of Omicron, where it reached a lot of them, there are certainly, most of them will say that, well, I'm now boosted with natural infection, which is fairly true for that, but after 3-4 months, it will be more than okay to get the advantages of the third dose. So we're insisting on that, but it's their choices. But we expect them to feel less protected in the near future if there would be another wave coming, let's say later this year, much later this year, then I think that they will agree to get vaccinated.
Merci beaucoup, merci à tous. C'est ce qui met fin à cette conférence de presse. Bonne journée.
Merci.